Hello everyone. I am Dr. Arun Shivaraman. I am from Coimbatore, Tamil Nadu. I am a consultant neurologist, and I just want to discuss about the social problems faced by epileptic patients in India. That is various parts of India, and we can categorize the population into urban and rural population. So first, before going into the problems faced by the patients, we need to know what is the prevalence, how many percentage of patients are there in of percentage of patients of epilepsy are there in India. So on a gross note, prevalence of epilepsy in India is around 12 million. So 12 million people in India are epileptic, and India shares around one-sixth of the global burden of epileptic population. I just want to classify these psychosocial problems as problems faced by children, problems faced during employment, and problems faced during marriage. Because most of the marriages in India are arranged marriages, we need to address those issues too. So when a child is diagnosed of having epilepsy, the parents might become overprotective, or they may neglect the child. So what will happen is most of the children are not allowed to go to school. They're not allowed to participate in any social activities. They are not being taken to any functions, any social gatherings. What will happen is they will feel isolated. So they will feel depressed. They will feel stressed out. Even this stress can aggravate the epilepsy, or they will become an introvert personality, which may lead to any behavioral or any psychosocial abnormalities. Studies show that parents with epileptic child, they don't allow their children to go to school. Very significant, because epilepsy can be controlled, and epileptic children can lead a normal life when they become adults. So what will happen? So when they cross the childhood, what are the issues faced by those people during their teens or in 20s to 30s? They have difficulty in getting employed. A study in South India revealed that around 58% of people with epilepsy are unemployed, as against around 20% among the general population. So this is a very high significant number. And the study also differentiated what were the reason for unemployment of these people. So the major reasons were any seizure related falls, any fatigue or drowsiness due to anti-epileptic drugs, so fear of having a seizure at workplace, and low education because they were not allowed to go to school during their childhood period. And even they are denied jobs just because they have epilepsy, and lack of motivation to do the job because of patient is having a chronic illness. So this has to be addressed in an aggressive manner, because if they are unemployed, they cannot take care of themselves, they cannot buy any drugs for themselves, and they cannot have a marital life and lead a peaceful life. So this, the tendency of not to employ an epileptic patient among the general population has to be addressed. This can be done with, for example, any mass media campaigns or any government policies or government mass media campaigns through Facebook, Twitter, or any advertisements in theaters or TVs. So every person will know that, have to know that epileptic patients are normal. And again, doctors has to adjust the dosage of anti-epileptic drugs to avoid any drowsiness or any fatigue. Those also addressed by the doctors. The patients also should be empowered, or they should feel confident that they can do a job. They should be motivated. And public also have to be taught that epileptic patients can be employed. So what happens during marriage? So I differentiated these problems as problems faced by both the gender, and problems faced by men, and problems faced by women. So what happens is, generally epileptic patients will have a late marriage, they have a high divorce rate, and most of the marriages in India are arranged. So the parents are bound to pay a hefty dowry to the bride or groom that they are getting to whom their child is getting married. And most of the parents tend to hide their child is an epileptic. If the children gets epilepsy post marriage, it leads to high divorce rate. What are the problems faced by men? So if a male with epilepsy is affected, they feel they have issues with unemployment, as we discussed earlier. So they fail to generate their income for the family, so they cannot be married. No one is willing to get married to an unemployed person. So what are the issues faced specifically by the women? They have issues in childbearing. In India, it is thought that epilepsy is a transmitted disease. If a mother has epilepsy, the child will have an epilepsy. Sure, there are some genetic epilepsies are there, but it is very rare. Fear of transmission to their children is a most common cause, a most common problem that is faced by the woman. And fear of thought that offspring, maybe the child may be mentally retarded or physically handicapped when the mother is an epileptic and taking some anti-epileptic drugs. And the conjugal life may be disturbed in this is a problem faced by both by men and women. An economical burden to the family, because the husband or a wife is an epileptic, they have to be on drugs. If it is a generalized epilepsy or a remote symptomatic epilepsy, whatever the diagnosis may be, they have to be on the drugs for a prolonged period of time. So that issue has also to be addressed. So I just want to finish my talk with what are the laws that are available, government enable epilepsy and laws that are available in India. I just want to focus on two things: epilepsy and marriage. Till 1999, there was a law that epilepsy was equated to insanity. Patient cannot have a legal marriage. I just want to read from that law. As per this Marriage Laws Amendment Act of 1976, a person subjected to recurrent attacks of insanity or epilepsy cannot have a legally valid marriage, and such marriage shall be voidable and resulting in divorce. This was the law. So Indian Epilepsy Association has fought very hard for that. And to 1999, only in 1999, in the late 21st century, Rajya Sabha has passed a bill that a person with epilepsy can have a legally valid marriage, and epilepsy is no more an illness to claim for divorce. So even our laws were against epileptic population. And I just want to quote about epilepsy and driving. As of today, as against other countries, some of the European countries, the government of India has no provision to issue a special driving license for people with epilepsy, no matter how long they have been seizure free. So people with epilepsy, even if they are seizure free for more than 5 years or 10 years, if they accept or if they declared that they are an epileptic patient, they are denied of having a driver's license. So if they are not having driver's license, for example, a job opportunity is lost. They cannot be employed as drivers. A job opportunity is lost for them. If they have to be dependent on someone or someone else to take them to a place, even to get groceries, they have to at least hire a cab or an auto. They have to take some of their friends to go there. So even the laws are against epileptic patients. I think these are the issues that has to be addressed, say about the social aspects that epileptic patients are facing in India. Thank you very much.